So we're looking at the anterior thigh compartment here, and we can identify the quadriceps femoris, and that consists of 4 heads. We have the rectus femoris in the middle. You can see right here. On the lateral aspect, we have the vastus lateralis. We can see some of those bundles of fibers going obliquely like that. Medial, we have the vastus medialis. And then deep to that rectus femoris, if I move it to the side, we have the vastus intermedius, which looks very tendinous in this region here. And together, all heads of the quadriceps will come down and they'll converge onto the quadriceps tendon right here, which will course over the patella, which is that kneecap, and then continue on to the patellar ligament. Sometimes people call it the patellar tendon, and that'll insert onto the tibial tuberosity here. So when quadriceps contracts, right, it'll pull like this, and we will get extension of the leg at the knee joint. Right? But in addition to extending the knee at the knee, the rectus femoris, this muscle here, is going to be unique in that it will also have a function at the hip joint. And the reason being is that we can see, well, we can't really see it, but the vastus muscles, the medialis, lateralis, vastus intermedius, they're all going to originate from somewhere proximal on the femur, which is that thigh bone, whereas the rectus femoris, as we can see here, if we follow rectus femoris up, it's actually going to connect, feel it a little bit, onto the anterior inferior iliac spine. Right? This is the anterior superior iliac spine of the pelvis, but just below that, it's going to be that anterior inferior iliac spine. Right? So because of that, it'll also do hip flexion.